Hello, everyone. Welcome to this webinar. This is the next webinar in the series that and if you don't know, I'm Jim Gordon, the founder and executive director of the Center for Mind-Body Medicine. This is one in a series of webinars we've been doing since the beginning of the pandemic. And my guest today, and I'm very happy to see him, and we've already been having an interesting and good time even before we got on air, is Joe Turner, the co-founder and current CEO of Exponents. And I'll tell you a little bit more about Joe and a little bit more about Exponents after we do a couple of minutes of slow, deep, soft belly breathing. But for now, welcome everyone. Welcome, Joe. It's great to be with you as always.
Glad to be here.
So let's just sit in a calm and relaxed and comfortable place. I noticed I changed my position a little when I instructed myself and all of us to sit comfortably and allow our breathing to deepen. If we close our eyes, we remove a great deal of external stimulation. Breathing in through the nose and out through the mouth with our bellies soft and relaxed. And this is a concentrative meditation. So we're concentrating on the breath, coming in through the nose and out through the mouth, on our bellies softening and relaxing with each exhalation, and on the word soft as we breathe in and belly as we breathe out. A little more relaxed with each exhalation. If thoughts come, let them come. Notice them, let them go. Gently bring your mind back to soft belly. Couple of more slow, deep breaths. Okay, slowly, gently, let's open our eyes, bring our attention back into the room. Oh, welcome. Welcome again, Joe.
Oh, great. That was great.
As I was looking forward to having you with me, I began to think about where we first met. And I want to give that context and then say a little bit about what Exponents is, and then invite you to talk about how you came to be now both the co-founder some 30 years ago and now the CEO of Exponents. But first, my first experience with the beginning of Exponents was in a church basement. My friend Howard Josepher, who was the your co-founder with Exponents, invited me to come see what he was doing and seeing if I was interested in being of help. And what he had at that point was a program for a small number of guys. They were all guys in the beginning, most of whom were just coming out of prison, and virtually all of whom were HIV positive, and many of whom had been addicted as well. And the guys were coming with paper bags sometimes right from prison with all their clothes in it. And I was, sort of so impressed and so moved by the possibility that was being offered, the possibility of finding a new path forward, of coming out into the world and coming into psychological balance and navigating a very difficult territory. So how did you, someone trained as a lawyer, civil rights lawyer, lawyer in general practice, a born and bred Brooklynite, working in sort of the legal fields, how did you come to be a co-founder of Exponents?
Well, thank you, Jim. But first, I have to thank you so much for inviting me on this podcast. You have been and remain one of my heroes. I know you're interviewing me, but you are part of the DNA of the good work that we do at Exponents. You served as board chair for many years. I want to acknowledge that, and I'm going to keep referring to it because this is not an arm's length transaction. Your heart is in it, just like my heart is in it. But yes, it was, I wound up in a church basement after practicing law. So I guess I'm a recovering lawyer, since many alcoholics wind up in AA meetings and church basements. But actually, I knew Howard Josepher, who's a co-founder, just a dear friend and brother. Howie had really cut his teeth on substance use disorder treatment. From his own personal recovery, he had really developed into an expert in building community. And so he received a grant from the National Institute of Drug Abuse to conduct a demonstration project. And we call it the ARRIVE program. And simply put, and I just want to give the context, this was right in the middle of the AIDS crisis. There are some similarities. I'm thinking now, I'm looking at the pandemic of COVID-19, but there was stigma, hysteria, the knowledge about transmission, and there were no drugs to treat at that time. There was just a whirlwind, and it was also right in the middle of the war on drugs and mass incarceration. So out of this grew a demonstration project to provide prisoners returning home with the resources to navigate both their substance use recovery, also to provide safe techniques regarding sexual behavior. We had bleach kits for those that were getting high to navigate that because of the specter of AIDS. So what we were doing, we didn't call it then, it was really harm reduction. And I'll say that because to participate in our program, abstinence was not a requirement. And we'll talk more about this, we met people where they were. We had a low threshold to access our services. And we had this saying that we could not demand abstinence because of the crisis of HIV/AIDS, because of the drug crisis. So we had a saying that sometimes we'll still say that dead addicts don't recover. So we accepted them as they were.
Joe, do you want to say something about why that was so important, and at that time particularly, why you were so far ahead of so many other organizations? Because so many people think that abstinence is the absolute way for people who've been addicted to substances.
Yeah, true. I mean, the prevailing notions and wisdom back then was that, the goal of treatment was abstinence, to be drug-free. But some of the data has revealed that there is a lack of success in total abstinence from engaging in these drug treatment programs. But more importantly, was that those were people that went through, but the people that were excluded from even entering the programs, there are no numbers for that. Many programs, Phoenix House, Samaritan Village, many of the residential treatment programs demanded that you be drug-free before you enter the program. That's like if you have cancer, you go to Sloan Kettering, well, we can't admit you because you have cancer. And then if you use drugs while you were in the facility, they would throw you out. So if I'm in Sloan Kettering and I, get a recurrence, they would throw me out of Sloan Kettering Hospital. So we felt that the urgency was so great that we could not wait for people to get sober or abstinent before we gave them these life-saving services of Arrive.
Yeah, and I remember, as Joe said, I've been with, and I said at the beginning, I've been with Exponents from the beginning for about 20 years. Every month or every 8 weeks, I guess, I teach a class, and it was amazing. One of the things that was incredible to me is, first of all, how many people came and were so attentive.
Yes.
And even you could see the people were still struggling, some of them with drug problems. But the people there, I often say this, the people in my classes, and by then it was men and women, and you've grown considerably, and
Yes.
want to hear about the growth, that they were so attentive. They were so attentive to the science surrounding immunity, for example, because so many of them had HIV, and they wanted to read the scientific papers that were showing that, yes, meditation or nutrition or exercise could enhance immunity. And they were willing to do these experiments to see what was possible. The other thing, aside from their openness, was the attendance. And can you want to say, even back in the earliest days, the attendance was extraordinary. Do you want to say something about that and give a little picture, a little feeling for the people who were coming and how they could come to, there were, 80%, 90% of the classes.
Yes. Well, absolutely, Jim. The Arrive program, as you well stated, was an 8-week, actually educational course that met 3 times a week. And the content was delivering not just the science around HIV/AIDS, but also addressing such issues as substance use, relapse prevention, meditation, nutrition, just a well-rounded curriculum whose target and purpose was an holistic wellness. In fact, and I'll say this I heard recently, and it really summed up our approach to substance use disorder and living with HIV, was that the opposite of addiction is not abstinence, but the opposite of addiction is belonging. And what we tried to build was a community of belonging, so that the staff, much part of the board, were people with the lived experience. So students that came in automatically related to the instructors, to the material. And we told them early on that you need to participate in your recovery. And not just in your recovery. As you stated, Jim, many were living with HIV, they were going to the doctor. And our admonition to them was also participate in your treatment. If you're in a clinical trial, sit the doctor down, explain it to me in a language that I can understand. How can I participate in my own treatment? So early on, we tried to provide our clients with agency, self-determination, which was the exact opposite of coerced treatment. And you're right. Your class especially, Jim, was, you had mentioned before about being associated for well over 20 years. We had experts to come in, and it wasn't, a hierarchical, top-down lecture to, recipient, but they found a sense of identification with all that you were saying. And many of those that were in class, we brought on to work for us. So we're big believers in the peer, one helping another, and this was the essence of harm reduction, and building community.
So what would be, can you give a kind of example? Give us an example of somebody coming into the program, coming through the program, and maybe coming out and deciding they want to participate in, as many of them do, as a peer counselor, as a volunteer, or
Yeah.
even a staff.
Mhm.
What would that look like?
All right. Okay. Someone is either referred to Exponents or Arrive, or it just may be a self-admission coming in, and they take the Arrive training course, which is 8 weeks. At the end of that 8 weeks, they receive a certificate. It's also a foundational training for other advanced trainings, but many go on to a number of other activities within the agency. Choice is the magic word for Exponents. We give individuals choice, and that's also a guiding philosophy when folks leave Exponents. That life is about choices and options. So they can choose at that point to go on to a number of different programs. If they're in need of a GED equivalency program, we have that. If they want to pursue the topics that they learned in Arrive at a higher level, we have what we call the Arrive postgraduate program, which is also certificate based. They could then
What are some of those things that they're looking at? You said Arrive included information about nutrition. I also
right.
remember people learn how to fill out, create a resume.
Yes,
People never
absolutely.
done that before. How do you deal with a job interview? Very practical. How do you
Correct.
deal with housing?
Yeah. I mean, if you look at the spectrum of wellness, we pursued that instead of abstinence. Wellness included, vocational wellness, spiritual wellness, nutritional wellness, medical wellness, community, and advocacy. So we framed our program around those indices of wellness. So you could pursue that. Many do choose to work for us. As either peers or counselors. We have one person that came in that started working with us. And I'll say his name because he is one of our stars, and I told him that I would mention him today. But Juan Jordan came to us about 20 years ago, recently released from prison, took the Arrive course, wanted to work for us. When he finished, we had peer positions, but we had filled them all up. So Juan said, look, you need somebody to clean the agency. You need somebody, these guys are not doing it. He started cleaning the toilets, started mopping. 5 days a week, we had to tell him to stop. An opening, of course, was made available in one program. Make a long story short, this is 20 years later. He has received his equivalency diploma, his bachelor's. He's working on his master's. He is now a senior director in charge of 3 different programs. Of course, that's a ratio algebra story, but many of our people increased their options for employment. Some chose to work at other places. The assistant commissioner of the Department of Health in San Francisco, I don't know the proper name, but a high-level position, is an Arrive graduate.
Mhm.
And so we're very fortunate that we've had over 12,000 graduates since 1988.
That's
Working in
12,000 graduates of an 8-week, 3 full evenings a week course in which people come on average, to 85, 90% of the classes?
right. We have a 93%
Well,
completion rate. Completion rate. Um,
incredible.
yeah, it is incredible, and so
Better than just about any university
yeah,
around.
I know, absolutely. And after people pay money. So I think that one of the reasons that people stick and stay is the promise of the community within, and the fact that we have increased their options and choices as to what to do with their life. Addiction is a very self-centered, lonely, isolating activity when substance use becomes problematic. So maybe the antidote of that, we're not experts, but maybe what has worked for us is a sense of selflessness. So advocacy, building community, belonging, we have seen to work with people who have struggled with problematic drug use.
From the beginning, Howard was a good friend, Howie, when I first came.
Yeah.
From the beginning, it wasn't just our personal connection, although that was really important. It was a sense that what you all were doing at Exponents was so similar in so many ways to what we were doing at the Center for Mind Body Medicine.
Yes.
And I hope people who've been, watching these webinars before, that you'll hear familiar phrases. You'll hear ways of looking at the world that are similar, giving people the power. Joe said the word agency, giving people the power to understand and help themselves.
Yes.
Grounding in meditation, respect for everyone.
Yes.
Respect for all differences.
Absolutely.
A holistic approach, bringing people who've come through the programs, coming there as students, bringing them into positions of leadership. And also the other thing that I always loved about Exponents, and that I hope we have too, is a sense of humor.
Yeah.
In the most troubled times,
Yeah.
that there's always room for laughter. There were tears, lots of tears, and anger at times, but also laughter. That all the emotions were available and admitted. That was
Yes. And Jim, you started out this podcast with medication. Meditation, which can be a medication, but you started out with meditation. Every Arrive class, we start and we end with meditation, a grounding. And we have found that when with our new students that come in, and we start class one and we said, okay, let us relax and get centered. There's some resistance, like, what's going on here? What's going on here? But by the 6th or 7th week, they are in, and we see it as a way to reduce stress, a way to be present to not just the Arrive class, but to be present for themselves. And it has worked for the last 30 years. So that's another similarity as well. So yes.
So, one of the things that always struck me, and you're talking about this one Arrive graduate who's moved ahead with his life so beautifully, is when I would come there, I think, what are all these people? Why were so many of them in prison? The crime, it's just, the people are so remarkable. And the vast majority of the crimes are nonviolent crimes. And
Right.
and this is Black History Month. So I wonder if you could talk a little bit about this whole mass incarceration of Black, brown, and some poor white people too. But what was going on? There are people watching us who don't really know about this. What was going on, and why was it so unjust and so detrimental to people?
Absolutely, Jim. And as we said, the Exponents really began in 1988, towards the end of the Reagan administration, which waged a war, a so-called war on drugs, and which actually turned out to be the mass arrest, the militarization of the police, as well as the criminalization of drug use. It was seen as a criminal justice problem and not a public health problem. And people were arrested. And as a result, the prisons filled up with drug arrests. There was a program in New York called the Rockefeller Program, which prosecuted not drug sales, but it prosecuted drug use. You could go to jail for using drugs, which sounds insane now. But this is what we were up against. And as a result of the criminalization of substance use disorder, the prisons multiplied, where Blacks were disproportionately represented in the penal system. In 1988, this country now, we have over 2 million people in prison. The former majority, disproportionate to our population, are Black and brown people. In fact, there are more Black men in jail, even today, in jail and prison, than there were enslaved during the Civil War. Some of the states, fortunately, now are letting people, but this is the scenario, this was the backdrop that Exponents began in. We found out also that substance use disorder has a disproportionate impact, harmful impact on people of color because of the intersection of health inequity, housing inequity. Look at George Floyd. Okay, George Floyd. I'm talking about the intersection of all these inequities. Where was he? He was in Milwaukee. Why was he in Milwaukee? He was looking for work. Okay, employment, income inequity. The autopsy revealed that he was COVID positive, health inequity. It also revealed that he had marijuana in his system, substance use. And as a result of this, that resulted in an encounter of an extrajudicial police killing. All of these intersected into the death of a person of color. That's just one of many. So we see a clear connection that addiction itself is merely a symptom of a deeper societal inequity. So at Exponents, we couple individual recovery with family recovery and with community recovery. They're wrapped, tangled, and tiled. There's an old Native American saying that says, self, family, and community are one. To injure one is to injure all, but to heal one is to heal all. So advocacy is a very integral part of the Exponents philosophy and way of engagement.
And Joe, I want to touch on a point there. During the course of these webinars and during the course of the last 10 months, as we've been working with a whole country that's been traumatized, one of the points that I've been making, that we've been making at Center for Mind Body Medicine, is that part of the process of healing from trauma, part of the natural process of healing as one begins to come through and out on the other side of it, is sharing with other people, connecting with other people, serving other people, being there for others. And that's what Indigenous people have always known was possible. And now psychologists call it post-traumatic growth. And I think that's what we see at Exponents.
Yes.
People coming in, not knowing which end is up. They've been in prison, they've been addicted, they've been, hadn't had much schooling, housing been bad. And they come out and they're in a very different place. They're no longer, and you said this earlier, when you're addicted, you're very self-preoccupied. I don't know if more self-preoccupied than a lot of America that's not addicted. But
absolutely
involved, how survival, and let me get the next fix.
Yeah.
And then to move into this place of caring so much about others. Whenever I come to Exponents, for years people knew me very well because I was chairman of the board. Now when I come, people don't know me so well or at all, but it's always warm. There's always a sense of people saying, welcome, welcome to our community.
That is so foundational of the harm reduction approach to engagement. We say that we see recovery in the eye of everyone who walks through our door. I think it mirrors an ancient Hasidic saying that you need to see the image of God in the other. You need to see the image of God in the stranger, the migrant. And that has formed us. That has formed our mode of engagement from the very beginning. You were so right about standing up for others as really enhancing one's own recovery. We say that a burden shared is a burden lessened. So coupled with our pursuit of wellness, individual wellness, for years, we have advanced advocacy. We've demonstrated against the Rockefeller drug laws, which I had mentioned earlier, mass incarceration, stigma regarding employment of people that were formerly addicted to drugs. These are issues that are central to one's individual recovery. But imagine the beauty of standing up for others now, not just for myself, but standing up for others. So
how can people? I want to continue our conversation, but just give people a website address. How can people find out more about Exponents now? And then we'll put up a card at the end of our talk so read it. But
simple. Just go to Exponents, exponents.org, exponents.org. We have a brand new website up there. You're going to see a great display of our services. If you look on the board of directors, you'll see the name of a young man named James Gordon, who was our board chair for over 20 years and guided the agency from a church basement to a really state-of-the-art facility now. I even hate to say facility, home. It's a home that has accommodated the growth of the agency. And not only got us there, but Jim has guided the philosophy and shaped it. He's modest now into it becoming a welcoming and loving community. So that's exponents.org.
Yeah, and it's really an incredible program, and especially any of you who's in the New York area, be in touch, support the program. There's a benefit coming up.
Yes.
And it's and how many employees are there?
Well, we have 40 full-time employees, and we have about 15 peers and volunteers. And when I say peers, those are graduates of either the Arrive program. We have 12 different programs. We have the Arrive program I mentioned earlier. We have an outpatient drug treatment program. We have a recovery center where people can come in out of the cold, have a cup of coffee. We don't beat them over the head with counseling, but we have activities of their choosing. It's a safe, warm place. We have a GED program. So many of them, when they complete, choose to volunteer. Yeah, so it's a pretty well-rounded.
So beautiful. I mean, I'll accept a little credit, but it's you and Howie and the whole community. And
Well,
and I think people fall in love with the program.
Mm-hmm.
I've brought visitors at times, and they've just they felt so welcome. They've been so impressed by the activities and by the people, the students who are coming there, the participants who are coming.
And we've done some marketing on social media, but our own records reveal that 90% of the people that come here are referred by word of mouth. And this is the community saying, this program cares about the people that walk through the door, and they're with you from the beginning to end. So, our reputation is really, it's grounded in authenticity. As I said before, well over 95% of the people that work there are in recovery themselves, or former prisoners, or living with compromised immune systems. So, we welcome them. We don't shoot our wounded. We welcome them back into the community with open arms.
Joe, I really recommend connecting. I first wrote about Exponents 25 years ago in a book called Manifesto for a New Medicine. I wrote about the sense of group and community and how powerful it was and is, and now it's grown so much. Speaking of now, Joe, now that all of these, during the pandemic, so many of these sort of chickens of the inequities have come home to roost and, caused tremendous suffering in communities of color. How do you understand what's happening, and how is Exponents relating to what's happening during the pandemic and to the people, as you say, the most vulnerable, the people whom it serves?
And also, Jim, you're so right. There are actually two pandemics. Of course, the dreaded COVID-19 and all the despair and sorrow that that has brought, and isolation as well, because it affected our agency where, about a year ago, we had to shut down services for about 2 weeks, on-site services. But what we did was to ramp up telehealth and remote services as well. And for the past year, we've been able to come in a couple of days during the week. But I think we've really maintained a sense of engagement, even with remote contact with folks. But for the people that we're dealing with, just, we're all isolated. We're staying at home, we're staying socially distant. And that can be so detrimental to someone who's in a shelter, so detrimental to someone who's in transitional housing.
So you're saying a number of the people who come to the programs, at least a significant number, live in homeless shelters.
They live in homeless shelters, and we're thankful for the technology to be able to reach them. But so much of what we do is based on contact and community. So as a result, not just our clients, but throughout the country, we have seen a rise, an unacceptable rise in overdose deaths. Coupled with the substance use is the introduction of fentanyl, which is a deadly drug. I think
to our viewers what that is and why it's so deadly.
Fentanyl actually is a prescription drug, but has been used to be combined with heroin that increases its strength exponentially and hence results in accidental overdose deaths for those that are using heroin. I mean, the figures have skyrocketed. From January 2020 to May 2020, there were over 81,000 overdose deaths. That's only 5 months of last year, and it's only 5 months into the pandemic. So who knows what the final tally would be? At Exponents, we've had a number of overdose deaths. So there is a pandemic of COVID, and there's a pandemic of accidental overdose deaths that are intersecting with each other. And I'll tell you, just as the nation reacted to COVID with emergency preparedness, preparation of vaccine, having a daily toll of infection, keeping the nation. We need to do the same thing with overdose deaths. It's unacceptable that we cannot get figures of overdose deaths. The latest figures were 16 months ago, but yet we feel them. So we have definitely been impacted with that. Fortunately, as I said, with remote services, we've been able to conduct telehealth counseling, and hopefully in the future with the vaccines. We had a town hall on vaccines with Exponents, and we're beginning to see some daylight at the end of the tunnel.
Now, are you and your staff able to get some priority in vaccination?
Yeah, we're able to. We're considered essential workers. Our staff, as we speak now, today, we have a number of appointments of staff getting vaccinated. And Howie got his vaccine, I think, the other day, so he's all set. I
got my 2 vaccinations too, so I'm ready.
I didn't get mine because I was bitten by the COVID bug, as you know, Jim.
Yes.
And so my last symptom was in early January. So my doctor said that the latest advice is to wait about 3 months before my vaccination. So, but when it becomes available, I'll be first in line.
You're recovering pretty well, huh?
Oh, I'm back to 100%.
Okay.
Except when my wife tells me to take out the garbage, then I say, I can't take it out. I had COVID. I can't.
Well, that hasn't changed, right?
But thank God.
One of the things that is so beautiful about Exponents is is that you are there for the most vulnerable, and people get who Exponents is. And I say who because it's like a person, it's like a
Yes.
community.
Yes.
It's been really interesting to see the outreach to the transgender community, and there some difficulties at times, and yet ultimately a kind of mutual understanding and acceptance and embrace. Can you say more about that? I think it's
Yeah,
really interesting because that's a community that is so ill served by so many institutions
it
in our
is. It is.
society.
Absolutely. And are suffering disproportionately from COVID as well. I think our first sensitivity engagement of the LGBTQ community as a whole was in our early days with Arrive and facing the HIV crisis. In fact, our response to substance use disorder was really fashioned by the response of the gay community to the HIV crisis. And what they did, and what we also embraced, was that they organized, that they told folks not to stop having sex, but to have safer sex. They also were strongly involved in advocacy for medicines, and they organized. So we saw that, and we said, "Wow, we want that same energy around substance use disorder treatment." So we had an early affinity and a welcoming of people from the community. As the years have gone on, and we're looking at the prevalence more of the trans community, we've also been, and what's so amazing, Jim, is that we don't hold ourselves out as a gay organization or specializing in LGBTQ issues. We're very sensitive, but I think as a result of our advancing community, belonging, advocacy, we have a large number of trans individuals, both participating in our programs, on our staff, and the issues are very unique. We also have in our outpatient drug treatment program, we have a special component dealing with trans substance use disorder because they're looking at issues like violence. They're looking at issues of overdoses, and we want to be sensitive to those issues. So I think just by us advancing an authenticity, we've attracted a large number of the trans community. In fact, we have been asked by a large organization to conduct a training on sensitivity to trans issues in their residential treatment facility. So I just wanted to mention that as well.
One of the things that I've always thought is that the model and the way Exponents does things really need to be much more widely known. And also, I think that the insights and understanding that you have can inform the whole discussion about what care should be, what community should be, what health and wellness are all about, and how people should treat each other in organizations that are designed or ostensibly there to help other people. I'm wondering what you see now as next steps for Exponents, and what needs to happen more generally in health and social services.
Well, what I see next for the agency is, yes, we have basic behavioral health services to address behavioral health, and even that term we're beginning to interrogate a bit because these are really wellness services. But I see our expansion and marching forward into the area of training. Now, we've been contacted by a number of agencies. What do you do and how do you do it? I see training in advancing harm reduction and harm reduction engagement as really the preeminent approach to substance use disorder. I see that because a harm reduction approach is coupled with not just reducing the harmful effects that drugs have on an individual, but also reducing the harmful effects that society inflicts on an individual. And, Jim, it makes no sense for someone to go through, 3-4 months of drug treatment and then come out into a world where they are crippled by inequity. So why don't we give individuals the resources to navigate that inequity? So that would mean wraparound services like vocational development jobs, like educational development, supportive services. And it also means advocacy as well. So I see us moving forward, advancing harm reduction, but coupled with a holistic sense of a holistic approach with supportive services.
And to me, that should be a model. I mean, it's in a sense, and I don't know if you would agree with this, it's kind of a third way. There's a medical model and there's an abstinence model. And then there's a much more holistic harm reduction model.
Yes, right. And that third way is actually the name of one of our programs that advances that approach as well. In terms of substance use disorder, there's the abstinence model, there's medication-assisted treatment, and then we see a harm reduction holistic wellness model where the goal of treatment is not abstinence, but the goal of treatment is wellness and recovery. So that's how we see it.
And of course, this is such an interesting paradox in a way, because by shifting away from abstinence and insisting on it, ultimately it does make it easier for so many people who want to be abstinent. They don't feel like, I've got to do this or I got to fight against it. You're encouraging them to find their own way forward, and it may well include abstinence.
And it may well include abstinence. We're very supportive of life-saving initiatives at Exponents. For example, syringe exchange. For those people who choose to use drugs, why not save lives by providing, clean syringes? Why not reduce bloodborne diseases by providing syringes? Also, overdose prevention centers or safe injection facilities. There's, everybody's hair gets on fire. Those who have hair, not me and you, Jim, but the hair gets on fire. Overdose prevention center. Now we have overdose prevention centers now, and we have places now where you can go to a safe place, consume your drug, be around friends. Everybody knows your name, and they call them bars, right? So I see some analogy to these self-injection facilities. So the main thing, Jim, is that harm reduction seeks to keep people alive until they can get to either treatment or make choices, get a sense of agency and wellness.
And it also, it appeals. I mean, in the work you continue to do in jails and prisons, reaching out to people and reaching out to, making yourselves available all over the city to people who want to come. It's there's a continual invitation, and I'm so glad that you accepted my invitation.
Yeah, it's a continual invitation and a radical welcome. That and Exponents, what we do for the person who walks in and is struggling, with addiction or whatever, is that we celebrate every positive change. We celebrate. If someone comes in and they're, consuming 2 bags of heroin, but they cut down to 1 bag, it's a big thing. It's a big thing. So that's our philosophy of radical engagement.
Great. Thank you so much, Joe. We're gonna have to come to a close. We're gonna just sit for a couple of minutes and meditate once again. We begin and end with meditation.
Great.
So let's just close here, Joe. It's always so good to be with you, and
I'm here, Jim.
looking forward to next Exponents board meeting, and also especially to being with you in person again.
Absolutely. Yes. Yes, absolutely, Jim.
All right. So let's just sit and breathe together. Just relaxing with each exhalation. Focusing on breathing in through the nose and out through the mouth, with our bellies soft and relaxed. Just relaxing silently, breathing. Thoughts come, let them go. Gently bring your mind back to soft belly. Okay, slowly, gently open your eyes, come back in the room. Thank you again, Joe Turner.
Thank you, my friend.
Everybody who's watching, I'll be back with you in a couple of weeks with our next webinar. Thanks for being with us today, and check out Exponents.
Yes.
Say again, what's the website, Joe?
It is www.exponents.org. Exponents.org.
Check it out, learn more. Thanks again, Joe.
Thank you, Jim. Thanks so much. Love you and miss you, and hope to see you soon, my friend.
For sure.
All right.
Bye, everybody.
Bye-bye.
In a couple of weeks.